Good morning, good afternoon, good evening, and happy Nurses Week. Welcome to the Ghanaian-Diaspora Nursing Alliance in collaboration with the Johns Hopkins School of Nursing, Center for Global Initiative, and the International Council of Nursing webinar. I am Dr. Matilda Decker, GDNA's Vice President and co-founder. Before we start the program, I would like to give a brief intro of GDNA. So the goal of GDNA is to link Ghanaian nurses internationally in the diaspora and Ghanaians in Ghana to advance nursing education. So currently we are a nonprofit that is registered in Ghana and the United States and with registration pending in the UK. We currently have about 500 members and counting. So our mission is to foster a sustainable local global collaboration between Ghanaian nurses in Ghana and the diaspora to advance nursing education and improve health outcome of Ghanaian people. And our vision is to significantly contribute to Ghana's ability to produce global nurses who are skilled and knowledgeable in specialty nursing areas to improve health outcome of Ghanaians. All right, so please take time to visit our website at GDNA or g-dna.org to read about our 18 fabulous executive board members and our 11 advisory council members. At this time, I will hand over to Professor Nancy Reynolds, who is one of our advisory council members, and who will introduce herself and her organization.
Greetings, everyone. It is a great pleasure to be with you today, and thank you for joining. I am the director of the Johns Hopkins Center for Global Initiatives, and I'm really delighted to be a co-host with the GDNA for this webinar that's focused on migration of nurses from Africa to high-income countries. The Johns Hopkins Center for Global Initiatives was established in 2011, and it serves as an operational umbrella for existing and developing Hopkins international education, practice research, and policy initiatives. The center believes in the investment of people and institutions to build capacity, and using the collective knowledge, skills, and experiences of nursing faculty and students and professional staff. The center's mission is to promote innovation, strengthen the nursing workforce, and advocate for the global advancement of nursing education, research, practice, and health policy. Among our many activities, the Center for Global Initiatives has a WHO collaborating center that hosts a community of practice that's dedicated to connecting nurses and midwives around the globe and providing them with equitable access to up-to-date evidence-based information via webinars, oral and written blogs, summary of research, and a discussion board. Johns Hopkins served as a secretariat of the global network of 44 WHO collaborating centers from 2018 through 2022. And in that capacity, we worked closely with the then Chief Nursing Officer at WHO headquarters, Elizabeth Eero, as well as other global leaders, including the International Council of Nursing, which is where I first met Howard Caton. And Howard Caton was appointed as the ICN's permanent chief executive officer in 2019. And prior to serving in that role, Howard Caton served as ICN's director of policy and programs for several years. And before that, he held roles in the UK, including at the Royal College of Nursing. He has really been a tireless advocate for nursing internationally. He's done a great deal to highlight issues surrounding nurse migration, and he recently co-authored a document with James Buchan, Franklin Schaefer, called Sustain and Retain in 2022 and Beyond. And if you haven't seen it, I would highly encourage you to take a look at that because it has many recommendations relevant to nursing migration. But now it's my great pleasure to be able to introduce Howard virtually, and we can take it away.
Hello, everyone. This is Howard Catton, the CEO of the International Council of Nurses, and I'm delighted to bring you greetings from ICN, from the ICN President, Dr. Pamela Cipriano, the ICN Board, and our more than 130 national nursing associations from right the way around the world on this, the occasion of International Nurses Day 2023. Every year, ICN establish a theme for International Nurses Day, and our theme for this year is Our Nurses, Our Future. And we set that theme for two key reasons. Firstly, we all know the incredible toll that the pandemic has taken on the nursing workforce right the way around the world. It exposed the lack of support, protection, and investment in our nurses. And we are simply not prepared to return to that situation again. We demand and we need greater support and investment and protection for nurses everywhere, for our nurses' future. But we also know that we need that investment not just for our nurses' future, but for the future health of people everywhere. When we look at the health challenges that the world is facing, the desire to ensure universal health coverage, access to healthcare for people everywhere, to address increasing numbers of people with non-communicable diseases, the prevalence of mental health issues, an aging population, all of these things and more beside are things that we simply cannot tackle and address without a sufficiently supported and invested nursing global workforce. And that is why our call for our nurses is for their future, but also for the future of global health. The two are intimately intertwined, interlinked, and interdependable. One of the things that we are going to be publishing on International Nurses Day is a resource pack, but also a charter for change, which sets out the 10 key actions that we believe governments everywhere around the world need to be taking in order to ensure the future for nurses and for global health. And one of the issues that we touch on in that Charter for Change is the issue of international migration and recruitment, the topic of your webinar today. And I congratulate you all. I congratulate particularly the Ghanaian-Diaspora Nursing Alliance and Johns Hopkins University for hosting this really important webinar on the topic of international recruitment. We have, as ICN, been monitoring very closely and reporting on migration recruitment, and we published a report last year called Sustain and Retain, freely available on our website, where we highlighted a significant increase in international recruitment of nurses. And we said that we could see how that was predominantly in response to a small number of high-income countries who hadn't invested sufficiently in their nursing workforce, weren't educating enough nurses, had shortages, and were using international recruitment as a quick fix to address their domestic issues. And we have said in our Charter for Change, all countries should be aiming for self-sufficiency in the education of their nursing workforce, should have robust workforce planning measures in place as well, and should take deliberate policy and political decisions to make sure that their health education workforce and number of health professionals are sufficient to meet their needs. But we also highlighted how we could see the impact of that recruitment activity on countries who were losing their nurses, and often it's the most vulnerable countries. We know that the nursing workforce is not evenly spread around the world, and the irony is that many of the countries who are at the forefront of recruiting nurses have some of the highest ratio of nurses to head of population, and the countries that they are recruiting from have some of the lowest. And we hear time and time again from nurses in those countries that are losing their nurses of the impact it has on the ability of those countries to continue to provide health services to their own people. They're already weak and often fragile health systems are being undermined even more by some recruitment activity. And that's why we are saying that we think that there is also a problem with the current global code of practice on international recruitment. We know that the code talks about ensuring mutuality of benefit between countries where recruitment activity takes place, but we simply do not see hard and tangible evidence of that mutual benefit. We hear a lot about countries who will say, we want to learn and to share our experiences and our learning between different countries. But when you look for the evidence of how that is being put in place, it's often thin. We think about this, if we think about this like climate change, if we know that we're going to be doing something which is harmful for the planet, then we think about how we can offset those actions by reducing our emissions, by planting forests, by recycling. Well, with international recruitment, it is actually the countries that are recruiting, those high-income countries, who are also recognized as having some of the really highly respected health education systems. They could surely come together much more actively to ensure the support and delivery of health education in the countries from which they are recruiting from. So we'd like to see much more evidence of mutuality. We'd like to see a strengthened global code of practice. We'd like to see much clearer monitoring and data of the flows of nurses, but also those measures to offset as well. But we also know that we have both shortages of nursing globally, coexisting at the same time in some countries as unemployed nurses, and we shouldn't lose sight of the root causes of those issues as well. Nurses whose pay and conditions are simply inadequate. There are nurses who carried us through the pandemic who have been promised pay increases and improved conditions and are still waiting for those to be delivered on as well. All countries, including those countries who are losing nurses to international recruitment, should be doing much, much more to ensure decent working conditions to support and to retain their own nursing workforce. We have, in just the last few weeks, colleagues, released a new report called Recover to Rebuild. It provides some of the latest evidence that we've collected from around the world on the state of the global nursing workforce. It looks particularly as well at this issue of international migration. It goes into much more detail. I've just really been able to give you an overview in these remarks. It highlights also the myth in some places that the recruitment activity that's taking place is just of younger, newly qualified nurses. That's not the case, colleagues. We are seeing recruitment activity deliberately targeted at more specialist and expert nurses as well. And the title of that report, Recover to rebuild, a little bit like our nurses, our future, is that of course we need to recover our nursing workforce because of the impact that we have seen on nurses right the way around the world. But if we don't do it, we won't be able to rebuild our health systems to face all of those health challenges that you and I are very, very well aware of. I know you have a fabulous panel who are going to delve into these issues in much more detail, and Isabel, James, Perpetual, and Nancy as well. I know we'll have great insights and thoughts on all of these issues. I'm sorry I couldn't be with you, but I'm grateful to be able to share some thoughts with you. Do look at those 2 reports from our website, and I hope that some of you will also be able to join us at our Congress in just a few weeks now in Montreal, Canada. Our theme for the Congress is Nurses, a Global Force for Health. Happy International Nurses Day, colleagues. Have a great webinar.
All right, thank you, Howard, for such an insightful message. And at this point, I will introduce our moderator, our GDNA president, as well as my co-founder. She is an associate professor at the Johns Hopkins School of Nursing and Bloomberg School of Public Health in the Department of Epidemiology. Dr. Commodore Mensah, please take it over.
Great. Thank you so much. Greetings, everyone. I'm so honored to have the opportunity to moderate our conversation today. And we will be talking about the migration of nurses from Africa to high-income countries. We'll discuss the causes, the ethical considerations, and policy considerations. So, judging from the record-breaking registration for this event, I think it's safe to say that this is an important and popular topic, and even more important because we are commemorating International Nurses Day a day earlier. So for 2023, we know that the theme is Our Nurses, Our Future. And I'm thrilled that we are also focusing on a brighter future for nursing in Africa and how African nurses can help to improve global health on the continent and beyond. So here's what you can expect for the next couple of minutes, 40 minutes or so. First, I'll frame our conversation briefly, and then I will introduce our esteemed panelists, and then we'll dive right into our discussion for today. We also want to hear from the audience, and so please post your questions in the chat, and later we'll have the opportunity to pose those questions to our panelists. We'll also have some poll questions later. Because we want you to add your voice to the conversation. So let's start by establishing why we've chosen this topic. So we know that the COVID-19 pandemic has affected the nursing workforce globally and drastically changed patterns of nurse supply and mobility, which has challenged the sustainability of the global nursing workforce. We also know that prior to the COVID-19 pandemic, there was a global shortage of about 5.9 million nurses, and nearly all of the high shortages were reported in low and middle income countries. And so the pandemic has also worsened the existing short supply of nurses and contributed to emergency policies to increase the supply of nurses globally. The pandemic has also heightened the risk associated with international recruitment, where it's cut the international supply to some high-income countries, but also has affected the push factors that contribute to the nurse migration from low-income source countries. So to that end, we know that high-income countries have looked to African countries and other low and middle-income countries to help meet this demand for nurses. But we also know this, that fast-track migration or international recruitment by some high-income countries will not solve the nursing crisis in their countries, but may actually undermine the ability of African countries to effectively respond to pandemic-related challenges. But as Mr. Caton also noted, There are also unemployed nurses in African countries and other lower and middle income countries. So obviously this is a complex issue and it requires a balanced discussion of the causes, the ethical considerations, and policy implications to secure a bright future for African nurses. So here with us today to discuss this topic are four esteemed nurse leaders who I admire greatly, and they will be contributing to this conversation. I will introduce them briefly, but please note that their bios are provided in the agenda, which is in the chat. So first off, we have Mrs. Perpetual Ofori Ampofu. So she is the president of the Ghana Registered Nurses and Midwives Association, or GRNMA, which has over 95,000 members. So GRNMA is the voice of the nursing profession in Ghana. And we also honored that she's a member of our advisory council. Next up, we have Miss Isabella Nana Asante. So she is currently the board chairperson for the Nursing and Midwifery Council, NMC of Ghana. And she's also the founder and CEO of Isabella Healthcare Services, which is a medical supply and services company. She's also a member of the GDNA Advisory Council. We also have with us today Dr. James Avoka Samani. He is team lead for the Health Workforce Division in WHO Africa. He is a health economist and a health system expert who specializes in decision analytic modeling and health system planning. And last, but certainly not the least, is Professor Nancy Reynolds. Dr. Reynolds is the Associate Dean of Global Affairs at the Johns Hopkins School of Nursing, and she's also the director of the Center for Global Initiatives. She's also a member of the GDNA Advisory Council. So thank you all for your willingness to share your insights with us today. Okay, so let's dive right in. I would appreciate it if you could help paint the picture of this issue. Is there really an issue of migration of African nurses to high-income countries? Is this really an issue? Are nurses leaving the continent in droves? And is there really cause for concern? So first, I'll call on Mrs. Ofori Ampofu to paint a picture of what's happening on the ground in Ghana, but we also know that this issue applies to other African countries as well. So Perpetual?
Thank you very much, Yvonne, and good evening, good afternoon to all our participants and the other panelists. It's a pleasure to be here, and I'm really honored for the invitation. So you asked that question, is it a reality? Indeed, it is a reality. And one thing that we know for sure is that it is not a new thing. Actually, nurses and midwives have been migrating since the 90s. Even during those days, we used to call it rapture, because you go to work with somebody and the next minute the person is gone and you ask about the person, she's traveled abroad. Currently, we are seeing a great movement of our professionals to the diaspora, more to the UK, Ireland, Canada, Australia, US, and other countries. And it became quite alarming for us as an association and a trade union, because one, we're losing members, we're losing our dues, and more importantly also, as one of our welfare benefits, we give loans to the members. So we're beginning to get quite worried, because the fear of taking away the money without us being able to retrieve it and have more people access it. So we've been tracking the numbers in terms of those who are going in for their verification with the regulator. And that was a good partnership that we went into with the Nursing and Midwifery Council. And that helped us to track in terms of each member getting clearance from our end before they continue with the verification process with the regulator. And in tracking the numbers, we realized that between 21st of January 2022 up to 31st of 2022, over 6,000, close to 7,000 of our nurses and midwives had actually passed through our offices. And then from January 1st this year up till March, up to 1,083 nurses and midwives had passed through. So it's quite worrying. And just like you indicated, it's not just about Ghana, it's about Africa, more especially about our region, West Africa, East Africa, and the rest. And more nurses are moving out, and it's all because of a number of existing push factors. And just like the pull factors are there. So the push factors basically poor working conditions, low salaries, difficult economic conditions that generally result in increased prices of goods and services. The fact that in most cases, you don't have the equipment and logistics to take care of your patients and clients, more so depending on the level of the health system that you are working. Poor working environment. If I tell you or you see some of the videos and pictures of where some nurses are working, it will amaze you. Some have to cross rivers, very difficult terrains just to reach the communities in which they are working. And especially that's with our preventive nurses, those in community health nursing, public health nursing. And it makes it very difficult. And sometimes you are posted to such places and it's as if the employer has forgotten about you. You are there and you're having to face all the challenges. All they expect from you sometimes is, oh, the data, we need the numbers. What are you achieving in terms of immunization, in terms of this and that? But the reality of how the work environment impacts the individuals, it's not taken into consideration because most of these areas lack social amenities. And therefore, even staying there to get a married partner if you're a young nurse or midwife, and having the social amenities like good schools for your children to attend are not there. And the opportunities to also progress in terms of your career, education, opportunities to get steady leave, and all those things makes it quite difficult. So all these challenges or push factors are what motivates our colleagues to move out there. And like I said, these challenges I've outlined is not only related to Ghana, it's related to Kenya, Somalia, almost all these countries. And indeed, it is an issue of worry because we all understand, just like Howard said, the impact is great and we should all be concerned to look at ways that we can address it.
Right. Thank you so much. And you highlighted a number of push factors. And I'm aware that the Nursing and Midwifery Council, NMC, and we're fortunate to have the board chairperson here. And they are also interested in this issue. And I understand that a study was conducted to try to understand some of these factors. So Isabella, if you don't mind, can you share with our audience today from the NMC's perspective, what are some of the push factors that you have gathered from your perspective?
Okay, thank you, Yvonne, for inviting me to be on this, to speak to such a worrisome problem. As everybody has said, it is a huge problem. It's an issue that has to be addressed. How best do we address it so that it becomes a win-win situation for us? So those of us are on the NMC board, and Perpetual is also a board member. We realize that part of our mandate is to advise on policy, to advise the government on nursing issues. So we thought that it was imperative for our voices, or the voices of the nurses, to be heard. So we commissioned a study to understand the push and pull factors. And I must admit, when the results came out, we were all surprised because the first thing one would have thought of would have been the salary. I have worked in the US, so I get the question all the time, oh, you guys make so much money. Or, so you start to think that people are leaving because of the the economic conditions. And that was not the number one reason that came up. It was actually number 5. The number one reason was to get valuable work experience. For me, it was, as much as I was saddened that so many are leaving, I was also hopeful. Because if somebody's not, the money aspect, we can't do anything about as Nurses and Midwifery Council. But if our nurses are saying that they want good experience, then we have some control over that. So when we came across the Ghana-Diaspora Nurses Association, it was such an exciting opportunity for us to collaborate. Having worked outside, having spoken to Yvonne and all the other advisors, you realize a tremendous amount of talent, Ghanaian nursing talent, all levels that we have outside, just as we have the same talent inside of Ghana. How do we marry the two? How do we give these nurses, how are we able to say, listen, you can stay in Ghana, and through a clear path for career progression, specialties, making them feel worthy, making them feel worthwhile. How could we develop those skills to make their experience valuable, to answer that question? The second one was better working conditions. Perpetual talked about it. What can we do? Once again, the government can do but so much. They are spread thin. I've also sat on the board at an administration, of a hospital, so I know how difficult it is. Unfortunately, as much as we are the biggest workforce in the hospitals, honestly, we're not the first people who come to mind when decisions are made. And I tell people all the time, we are part of a valuable part of a team, but we make or break. The doctor is as good as his nurse, and he's as bad as his nurse. If you don't get your nursing right, it'll be very difficult for you to get the hospital and have the healthcare right. So how do we improve? Work with the governments, work with nurses in the diaspora, work with international agencies to improve the working environment for our nurses. Better living conditions. Perpetual mentioned that. That's number 3 on the list. How do we create I have a vision of, why don't we situate a nursing school, a specialty, especially because we have a lot of general nurses in Ghana. We don't have enough specialty nurses. How do we situate nursing schools, specialty nursing schools in each region? How do we encourage nursing students to apply to these schools within their regions? Their families out there, their support systems out there. If we encourage them to train there and stay there, it's easier for her to find her partner, like Perpetual, for him to find his partner, because there is, their support systems are there. Then the government doesn't have to worry about finding them accommodations because they're from that area. How could we, in our advisory role, play a more, have a more prominent voice to tell the government that, listen, maybe these are, it's not about the money. You'll tell us you don't have the money, but how could we do these other things to encourage our nurses to stay? The other thing too was public recognition. I mean, and I have to be guilty, my board has to be guilty. How many people in Ghana know about Nurses Week? In the US, every hospital, every nurse is celebrated. How do we also start celebrating our nurses? How do we blow them up? Perpetual's Ghana Association does an amazing thing when they recognize nurses. Last year, they gave a car to a nurse in Ghana. It's like, you bought them a whole house. It's a huge deal. She talked about some of the conditions that they have to go through. So how do we give voices to people who are doing so much within the nursing profession that we don't get to hear about all the time? All of these things the nurses listed before we got to the pay.
Wow.
So maybe so it was quite enlightening, but like I said, it was also hopeful because it gives us an opportunity to join hands, join forces, and what is within our power. We won't get everybody, we can't stop everybody leaving, but at least if we get this part right, if they do leave, they'll be more likely to see, open their eye, learn, and come back and translate it and make it better for all of us within the Ghanaian system.
No, thank you so much for sharing some of those data with us. It's pretty striking what you said about the number of reasons not being paid, but actually getting work experience. So, and someone may wonder whether some of these issues are unique to the Ghanaian context. So we're actually very fortunate to also have Dr. Avuka Asamani on the panel today and his role in the WHO Africa region. We would love to hear from you, Dr. Asamani. Are you hearing similar factors in terms of push factors from the African region? Are you surprised? Are you hearing similar stories in some of your work in the African region?
Thank you very much, Yvonne. And let me say good evening or good afternoon, good morning, depending on your time zone. And first of all, let me take the opportunity to thank nurses and to congratulate you on the International Day of the Nurse, which comes off tomorrow. In WHO, we do take the work of nurses very seriously, and we appreciate the work of nurses. And so we take every opportunity to celebrate you. Now, back to the discussion. Indeed, the issues are, it's like having a template, and in every country, you just remove the previous country and put the new country's name there, and the story remains the same. Why do I say this? Well, migration has been with us for years, and it's not going away. It's going to be with us forever. This is because everybody would like to move for different reasons. It is when migration is at levels that is becoming difficult to sustain from the country they are living, that is when we are now beginning to get worried. And I have always said that it is not necessary or desirable to stop migration. It's only useful to manage it. If you look at the African region, especially with the advent of COVID-19, COVID-19 did something. It created so much panic and demand for nurses, especially in almost in every country, but the countries that can afford, like the high-income countries, unfortunately, they are failing to produce enough nurses to meet their domestic requirements. So failing to do so, they have turned more attention to recruit from other countries. And this is one of the issues that when we talk about the push and pull factors, we look at it from the perspective of a market, a labor market. And from the perspective of a labor market, there are a couple of things that do interact among themselves. First of all, in Africa, 1 out of every 3 nurses are either unemployed or underemployed because there's not enough budget by government to employ them. That's one thing. So they would naturally want to move to where they can find jobs. And more especially in Ghana, in the 5th Global Forum, the Minister for Health, Honorable Kwekwajiman, actually mentioned that there were about 68,000 unemployed nurses in Ghana as we speak. And that is a staggering number. You can't take that for granted. Now, that's one side. The other side is that remuneration for nurses, to be honest, is also not on par with what is necessary for them to be able to live a good life in most cases, in many countries. And their working conditions is also not what is supportive enough. All of this put together will definitely push people to want to look for something elsewhere. And so it's not very surprising that we've seen the numbers go up when the high-income countries have decided to escalate recruitment from other countries. So we begin to see, for example, in Ghana, we understand at the moment, there are about 16,000 applications at the Ministry of Health asking for clearance from the Ministry of Health to enable them undergo processes to migrate. That's a big number. Many countries in Africa don't even have up to 16,000 nurses. We saw in Zimbabwe in 2021, they lost 5,000 workers in one go, in 1 year, to the extent that even people who were supposed to be tutors and to teach the next generation of nurses, they were no longer available, they had left. So how do we even regenerate the nursing, the stock of nurses? We've seen the same in Nigeria. For example, there's a hospital in Lagos that has reported that every week, 15 workers, mainly nurses, resign from work and migrate, 15 per week. That is not something that any hospital can sustain. So it is at these record levels that we begin to get worried. Now, there are a couple of other nuances that we need. With the worry is not just about how many numbers are leaving. Potentially, like the previous speaker said, some of them are going to look for experience. But one other thing is that a large number of those leaving are taking jobs lower than their current level of expertise in the destination country they are going. What it means is that they come back worse, or they are not coming back with better experience, actually. So if a nurse leaves, let's say, the shores of Ghana as a registered general nurse who has a degree and goes to another country to work as a carer in a care home, after 5-10 years, they come back and think that they have come from a high income. They've come with almost next to nothing to add back to the system in Ghana. That is not valuable experience. If you come back and they put you at a senior level post, you are not adding much to it because you didn't gain the clinical experience that you needed. This is something we are worried about as an institution that support governments to come up with good policies to support nurses. But the bottom line is this: Africa will not be able to compete with high-income countries when it comes to remuneration because our economic minds are different. That is a reality. But how can we manage this situation such that it to be a win-win situation for Africa and for other parts of the world? I believe there will be more opportunities to shed more light on what we think countries can take action on. Let me stop here and over to you, Bob.
Oh, thank you for sharing those striking numbers in terms of the numbers of nurses who are leaving Ghana and leaving Nigeria. And so, like you said, we'll talk about how this issue may be managed, because I think you said that it's not desirable to stop migration, right? It's natural, it's a fundamental right of every nurse to choose where they want to work, but we also need to manage the situation. So now I'd love to turn to Dr. Nancy Reynolds. So you were involved in the writing of the State of the World's Nursing Report. Can you comment on whether some of these issues that we've talked about came up in the report, and share any reflections that we could learn from that seminal publication?
Thanks so much. Yeah, and it was really a wonderful opportunity to be able to work with a team that helped to collate the most comprehensive data about nursing around the globe for the first time. And this report detailed many different dimensions of the global nursing workforce, and it ultimately concluded that nurses have wonderful contributions to make to nursing and toward the achievement of the strategic development goals, but that we need greater investment in nursing for them to be able to achieve their full potential. And the data, when this report was completed in 2020, showed that we have around 28 million nurses in the global nursing workforce. And the density is about 37 per 10,000 population. But this sort of figure masks the real disparities in distribution, as we've been talking about here, because, for example, there are 10 times more nurses per 10,000 population in the Americas than in the African region. So that plays out to about 83 nurses per 10,000 in the Americas versus 8.7 per 10,000 in the African region. So huge gap there. And so and almost 90% of the shortfalls in nursing occur in lower and middle income countries. And we've been talking in this report about many of the factors. They vary from country to country, but across countries, we could see that the real issues were underfunding, staff shortages, low salaries, lack of lifelong learning and career advancement opportunities, poor workplace conditions, and lack of basic supplies and inadequate presence in healthcare leadership and policymaking. And one comment I'd like to make that I think is a real issue for nursing globally is that nursing workforce is often looked at as a cost to healthcare organizations and countries, when in fact, there's very good data now that we know that investment in health leads to better population health, better economies, and nurses are critically important to health of our populations. And we have a skill set that is so needed for the complex health problems that we're dealing with in this century. We saw this with the COVID-19 pandemic, the innovation and hard work that nurses brought, but also in managing non-communicable diseases and looking at the fallout from climate change. The way we can deal with vulnerable populations, we're seeing increased migration. There's so much that nurses can do, but they've got to be looked at as an investment and not as a cost. And what we're seeing in the US, unfortunately, I mentioned those figures about the shortage in 2020. It's now estimated that maybe we had about a 6 million nursing at deficit. Now it's thought maybe as many as 13 to 30 million a deficit in nursing. And nurses in the US have been leaving in large numbers, and they're not going to other countries, they're leaving nursing altogether. And of course, nurses, US turns to other countries to try to fill that gap, but that's really a short-term solution and not an appropriate solution.
Oh, yeah. Then thank you for sharing those insights from the State of the World's Nursing Report. So one might say that, well, if there's a 13 million nursing deficit in the US, then why not open the floodgates and allow the 68,000 unemployed nurses, for instance, in Ghana to leave and go abroad? So I want to throw this question to the panelists. So why try to manage this issue of migration and do it in an ethical way and a thoughtful way? Should nurses be allowed to leave, or recruitment agencies be allowed to go to these countries where nurses are unemployed and recruit without any sort of regulations or checks and balances?
I mean, I think that I was reading the questions and somebody talked about bonding. I know in the past when you go to school on the government's tab, then when you come back, you're supposed to work for a few years. But a lot of nurses are self-financing now. So that does not apply. In terms of regulating it, where we've gotten to, like you said, it's a fundamental right. You should be able to work and live a good life, have a good life for you and your family. Our problem is the types of nurses who are leaving. Most of the time, they're not employing the 68,000 that's at home. They're employing the ones that are already in the system, who've gained the experience, who have gone on to, get some specialty training, oftentimes that on the government ticket, they're the ones who are leaving. And so it's already, we are at a disadvantage because you say Ghana has so many nurses, but how many are actually on the floor? How many are actually practicing? So when you pull those out of the system, then you widen the gap and you put all of us at risk. So why don't we start thinking of it as push and pull? Stop thinking of it as a push and pull and see how it could be a win-win for all of us. A win-win is in the sense that we need specialized nurses. There's an abundance of specialties. There are nursing schools, there are Johns Hopkins. Could we have the type of arrangement where if you're taking our nurses, you're taking our critical care nurses, is there going to be some kind of knowledge transfer? Rather than take money for the nurses that are leaving, could we come back and train nurses? Those that are going, could we do like an exit? You're leaving Ghana, why are you leaving? You know, we did this study, yes, all right, but it's a few number, you know, how honest is it? Could we get them on a one-to-one basis when you come for your verification? Could we ask you why you're leaving? When you go, can we find a way to track them and see their experience? Are they going to work as registered nurses, or are they going to work as nurses' aides? Once the reality has hit and you realize that the grass is not always greener on the other side, are you trying to come back? And if so, how are we welcoming them back? Ghana, the nursing education now teaches entrepreneurship, an amazing thing. I would never have been able to open my own medical supply company in the US, but here I am in Ghana as a nurse doing this. So could we, those who want to come back, how do we facilitate that? How do they see? I like to think of the challenges in our systems as opportunities for improvement. So once you've gone and you've seen what's out there, you will see the good, but you also will see the ugly. You know, how do you then bring it back and do something and make it better? So I think for me, the push and pull is a bit antagonistic. Why don't we find ways to make it a win-win? Yes, fine, you need, your nurses are leaving. All my co-workers in the US are dying to leave, but unfortunately, we're all in our 50s and they're close to pension age and they can't leave, you know, and they're miserable in the system. So fine, we have nurses that need to go, but as you're taking our specialized nurses, how are you replacing them for us? You know, we need skills, we need people. Part of the things that I have seen in nurses is that we're not confident because we lack skills. There's another thing that came up. People want to go back to school. They're not getting the study leave. You know, can we facilitate nurses coming in to train, you know, certification? It takes a few months to certify. Those are some of the things that I think we should start looking at. This way, the nurses who want to leave can leave. But those who want to stay, we make it easier. We give them clear push, you know, we encourage people to do things outside of the nursing profession. Professor Aziato, she is so celebrated. We're so excited. For once, we've seen a nurse rise to a high position that is not traditionally viewed as a nursing position. Why can't it be a nursing position? You know, so I think that we as a profession start standing up with our head held up high and demanding to be heard and demanding the seat at the table and demanding and making people realize that when you don't get your nursing right, it affects every single one of us. So let's stop thinking of it as push and pull, like you're pushing me. You go, no, you come back. No. How do we stop? And how do we find solutions that works, that helps the 68,000? So, because if you're pushing some out, then some are coming in and they're being trained and they're doing what they want to do. We're telling them you could be a nurse, lawyer, you can do this, you can do that, and give them an opportunity to thrive in whichever environment they find themselves in.
Thank you for that framing in terms of changing how we talk about this issue, not just push and pull, but also thinking about talking about it in a more productive way. I know Perpetual is eager to jump in and talk about the fact that, you know, when these nurses are leaving, it's not those who are unemployed, but it's the best and the brightest that are being taken away. And I think Dr. Avuka also alluded to the fact that sometimes when the nurses leave, they may leave a critical care setting and go work in a nursing home, or work in a setting where they're not allowed to use your skills and training. So Perpetual, what are you hearing about some of the nurses' experience when they do migrate? And how do we factor that into the conversation?
Thank you, Yvonne. So in terms of experiences, let me zoom to the more recent one. You know, Ghana went into a bilateral agreement with Barbados and has sent 2 cohorts, nurses already. And from what they shared, they are fine, salary is good, they're able to save. And for us as a union, we did not just leave them, we followed up with our counterpart, the Barbados Nurses Association. We are both under the International Council of Nurses. And we had discussions in terms of getting them to follow up on them and ensuring that they are registered with their union, paying their dues so that they step in to address some of their issues for them. So, you know, we actually losing the cream of our profession in Ghana, in Africa, in all other countries. And we will need to address the issue strongly. You know, I always say that if I am not well, I live in Ghana, if I'm not well, the next minute, the closest hospital is where I'm going to be pushed. It's an emergency. And I want to be sure that the nurse who is going to take care of me has the requisite knowledge and skills to do so and save my life. And it is worrying if we are losing our specialist nurses. We are losing those who have the many years of experience. And indeed, if you look at the workforce, the nursing workforce at this time, disaggregate that data, you realize that we actually don't have enough of the professionals in terms of the diploma and those with the degree and so on and so forth. And therefore, for me, I think that we need to look at our training. We need to look at our training critically. We continue to train auxiliary nurses. In fact, these developed countries who are coming for our nurses, or these countries into which our nurses are running to, are not interested in those auxiliary nurses. They are interested in those who have, the least should be the diploma. They are interested in degree, and the add-on specialty is always a plus. So we have to stop the auxiliary training and focus more on developing our professionals at the degree level to have that add-on specialty by strengthening our Ghana College of Nurses and Midwives, so that we can train more of these professionals. And once we have a larger stock of our professionals, we can delve into this bilateral agreements that we are going into. In that case, we ministry trying to impose a ban on getting clearance, and therefore there's that backlog of just are waiting. About 16,000 that are applicants that are waiting to be processed. And in that case, we can have enough to take care of our own needs in country and have enough to also properly package to work in other countries, because there they get the experience, there they get the money they are looking for, there they can remit money back to the economy, to their families, and it also boosts the economy. We need to improve the working conditions. That is no doubt. We need to improve it. And beyond that, even as we find ourselves here, just like Madam Isabella said, if the data that we have now shows that majority want to gain that experience, why don't we have an exchange program with various universities, with various facilities out there, so that our nurses can go out there and gain some experience for a month, 2 months, 3 months, come back, transfer that knowledge to their colleagues that they work with in various sectors, and that can actually help. If you look at the thousands who are still sitting home to be employed, that is a huge loss for us as a country, because we don't have money to recruit them. The association diploma training or degree training. So it's a big headache. But if you go into that data to begin to sit as stakeholders, not for the Ministry of Health or for the Ghana Health Service.
So I think we are having some technical issues with Mrs. Savorian Poffo, but we will get her back on. So I think her comments are a good segue in terms of talking about solutions. So we know that this is an issue. We know that it has to be done thoughtfully. So now I'm going to just transition and ask our panelists to talk about perhaps policies that can be implemented. There were suggestions in terms of creating exchange programs so that when nurses leave, they can find ways to give back. So one of the things that the Ghanaian-Diaspora Nursing Alliance is hoping to do is that we are mobilizing nurses, whether they train in Ghana or not, people who are passionate about advancing specialty education to contribute to elevating the nursing profession. So there are a lot of things to be said about what can be done. So first up, I will invite Dr. Asamani. So Dr. Asamani has written extensively about the nursing workforce and has talked about policies that governments in Africa can implement to address this issue. So Dr. Asamani, if you can offer for our audience maybe two policies or solutions that may help to address this issue.
Thank you very much, Prof. First of all, let me look at it from two angles. One, a more global angle, and also a more country-specific angle. From the global angle, it would be recalled that in 2010, WHO, working with the countries and partners, came to an agreement in what is now called the Global Code of Practice on the international recruitment of health workers. This code actually outlines a set of ethical principles that countries need to observe when they need to recruit workers. Now, one of the provisions in the code, which specifically discourages active international recruitment from countries that have high levels of vulnerabilities, has been talked about many times, and sometimes maybe not also well understood. One of the issues in that is that, for example, in recent 2020 and this year, WHO has identified 55 countries as of now that are facing severe vulnerabilities in terms of their health system. They have low density of health workers compared to the population, and they are not making good progress when it comes to access to health services. That happened to be one of them. 37 out of these 55 countries are in Africa, actually. That happened to be one of them. Zimbabwe happened to now be one of them. Zambia happened to now be one of them. Rwanda, the same, said recent addition. Nigeria has also been one of them. So many of our countries we're discussing here are part of this. But one opportunity that is here is that, and I want to put this clearly, that the code is actually provides an opportunity for collaboration between countries to be able to have mutual benefits. In this, we are recommending that high-income countries where their domestic supplies are not enough to meet their demands, can you have some negotiation with these low and middle-income countries so that you can have a government-to-government arrangement that you recruit the health workers, in this case, many of the nurses, and at the same time, you also invest back in that system to ensure the system can replenish and better strengthen so that the system do not suffer undue shock and face a risk of collapse. So this is what we usually call the bilateral agreements. It is refreshing to hear discussions around this during the recently held 5th Global Forum, where high-income countries have come to the realization that they want to voluntarily come together to partner to see how best they can support countries they are recruiting from that have these kind of vulnerabilities. And I'm happy to to note that a country like Kenya has recently signed an agreement with the UK government. I know the UK government is exploring to sign one with Ghana, with Nigeria, with Uganda. So yeah, it means that some progress is being made now. And let's see what goes into it. What I would appeal is that nurses themselves should be on the table when these discussions are being made. Discussions and agreeing on arrangements cannot be made about nurses without the nurse, and it will be meaningful. Nurses should be there. Now back to the country, more country-specific way on how some of these issues can be addressed. Every country is different, and we do recommend that every country should understand the labor market dynamics in the country through an in-depth assessment of the factors that affects the labor market and why people want to leave. When that kind of study is done, it allows for better policies to be crafted. For example, we just heard from colleagues that in Ghana, maybe we are training too much of some cadres and less of others. High-income countries are not interested in those we are training too much. They're interested in those we are trained less. And more so, they're not interested in the recent graduates who have no experience. They're interested in those who have used the system. They have experience. They are now holding more responsible positions and would be able to contribute better to the system. They're interested in those ones. So when they leave, there's a big void that is even difficult to fill or take many years to fill. So all of these ones, how can we better come to a point where people can still live without we are not interested in infringing upon the right of anybody to migrate. People can still live, but in an orderly way, in a way that the system also benefits. So the solutions are usually there, but the key challenge is maybe it needs a little bit more money. It needs a little bit more political will. It needs a little bit more advocacy for us to produce more health workers, take into account those who want to leave, for us to be able to employ the health workers, and more than just employing them, pay them decent and fair wages, give them conducive working environment, and also respect them and value their work so that they can feel valued and to stay. These are key things that need to be done in the country, but it all starts with the political will and having the budget space for it. Unfortunately, most countries in Africa have limited budget space to expand investment, but we can still innovate around it and find solutions. I think it starts with we the nurses to advocate for better planning so that we can avoid the situation where we have shortfalls of health nurses in the front line of service delivery, but at the same time, a paradox of having unemployed workers, and yet we don't want people to move. We need to better plan and allow the system to reach some equilibrium.
Absolutely. Thank you so much, Dr. Asameni. So, Dr. Reynolds, I'll turn to you now. So, in your role within Johns Hopkins University, and you're also affiliated with CUGH, the Consortium of Universities in Global Health, would you say that we know enough about sort of the nursing workforce in terms of research in the African region? So what roles do you think universities can play in trying to engage with African countries to really understand some of these factors that contribute, but also how to implement some of these strategies?
Yeah, no, I think it would be fabulous for researchers at different institutions to partner to look at these. I don't think we always know enough about the nuances of this issue. I also think we need better data to inform workforce planning. I think there's a gap between government knowledge about educational systems, how many nurses need to be produced, what are their skill sets. And I think there's a big role there for research as well. And I also think that we really need more research showing the value of nurses to countries. As I mentioned before, the issue about cost. Nurses are often looked as a measure that they cost a country something rather than as something that's going to improve the outcomes for the country.
Thank you so much. And I know we lost you for a second, Perpetual. So right now we're talking about solutions, strategies, policies that are needed. And I know we are almost at time in terms of hearing from our audience. what are maybe one or two policy changes that you would like to see to address this issue?
Okay, thank you, Yvonne. I don't know what happened, but I was still speaking. So let me just repeat what I was saying. I don't know whether you got it. So I was talking about the training, the need to actually relook at it and strategize in terms of which cadre of nurses that we train, which will meet our local needs and at the same time put Ghana in a position to go into bilateral agreements and export them. And then we can also improve the working conditions and go into exchange programs and develop more partnerships with universities abroad and so on to help our professionals upgrade their academic levels, and that will also impact the practice and skills they are practicing. So these are about you, and I think that we all have a lot of work to do. The decision to travel or to migrate is an individual's decision that should be based on information that is readily available for these people. I know in this conversation, we talked about the fact that some they work at a level where it's way below what their training or their license avails them to do. But the truth of the matter is, they look at the money, what they are going to get from that, and compare it to what they were getting back home, and it's far better. And so they choose to do that work and get the money that they are looking for. So fundamentally, people can give various reasons, but if it's about traveling to see and to see what is out there, maybe people could have gone for holidays, but people go out there to work and get money to come and address their socioeconomic needs back here in Ghana or anywhere else.
Great. Thank you so much. And Ms. Asante, we'll give you the final word in terms of policies that you'd like to see implemented to address this issue, to ensure that when nurses do migrate or are recruited, it's done in an ethical manner that protects the rights and the interests of these nurses when they do migrate.
I think pretty much everything has been said. What I would love for the policymakers, the ones who actually make policies that become substantial, I would want for them to appreciate that at any moment now, you could be a patient. Your family member could be a patient. Any encounter with within healthcare, that could be at any second. So I think that when people start appreciating how the situation impacts them personally, it brings more passion to the table. It brings more understanding to the table. I think they need to appreciate that I am a labor and delivery postpartum nurse. I could never function in a critical care because I'm not trained for it. So if you have 100,000 general nurses and COVID comes and we need nurses in the critical care areas, you haven't really done much for your system. So the importance of the nurse's voice at the table cannot be underestimated. We can only be our own advocates. Once we get that right, once we push for a place at the table, then we can let them say that, listen, we have a right to go. You can't stop me from going to live my best life. But how do we do it so that the nation benefits, so that you, the policymaker, who's writing that policy, benefits from it? So in being intentional with our migration issues, being intentional in that, listen, we have to benefit. Africa has to go to the table to say, listen, you need something from us. Low-income countries, you need something from us. I need something from you. How do we both end up getting what we want? We get the skilled nurses and you get your workforce. At the end of the day, we will not be having this conversation. We will come back and be happy and say, no, listen, these policies are working. How do we tweak it to make it better? So I think that it's just, it almost seems like a no-brainer. And so I don't understand why it's taking so long. But then again, we all know the bureaucracies. But like Dr. Reynolds said, the first thing is to truly understand the magnitude of the problem. Unfortunately, we don't do well in our part of the world with data, with research. So let's start off with that. Let's really get a clear picture, do a thorough needs assessment to see exactly where the voids are. The other countries can bring theirs to the table. This is what we need. So how do we both marry each other? So I think that just getting that data is the first step that we need to take, so that when we go into the table and we have to speak on issues, we're speaking confidently, knowing that what we'll get in return is indeed what we need.
Absolutely. So it can definitely be a win-win situation. So thank you for sharing that. And so we'll give Dr. Asemeni the opportunity to just help conclude this segment in terms of, from the WHO perspective, what are some policies or opportunities that you see, and we'll transition to sort of the poll questions that we have for the audience. So Dr. Asemeni.
Thank you. What I would like to say, and let me first of all give a disclaimer about something I'm about to say. So don't quote as WHO, it's James. In 2017, during the GRNMA conference in Cape Coast, I was privileged to, and that time the president now was General Secretary, I believe, yeah. I was privileged to make a presentation on the value of the Ghanaian nurse. And for the first time in that discussion, I understood how nurses were passionate about how they are looked at, whether they are valued or not. And one of the calls I made at the time, and I believe is still relevant today, was that Ghana needed to move away completely from training the certificate nurses. From the employer's perspective and from the profession perspective, at the time, my view was that, look, many of the community health nurses, enrolled nurses, diploma nurses, what they do, once they get their job, their first salary is used to pay school fees in a private school to start doing the degree. They are not focused at work. They are negotiating for night duties and to be able to school. And once they finish, the next thing is they are competing themselves on how to be upgraded to the next grade. The question I have is, and quite honestly, many universities, private universities in Ghana are not better off than the nursing schools. They could be awarded first degrees, by the way. And that will minimize how much that tussle is going to be. Now, my views as a person hasn't changed much from that, because if you look at Ghana's situation at the moment, it is still the case that we are training more of some cadres and less of others, that those that we are training less, we are losing them. So it's one of the things that I think the NMC attempted to minimize the training of those cadres that are, for now, are seen as temporary, like placeholders. People get in to be able to move to another, but maybe it did not quite work. But I think it's still worth taking a look at it. And I saw Perpetual was drifting towards that discussion as well, which I believe is still necessary. Now, moving away from that one, and very quickly before I go, is that migration of nurses, there's one fundamental issue. I don't know whether it is an Ghanaian issue or it's an African issue. In Ghana, the term being called a burger is a problem. People want to be called burger, they live abroad. And that in itself is a prestige. That in itself is a prestige. whether that has added value to them or not, that necessarily is a prestige, and they want to have that prestige. Now, it's important we make clear for people to understand. We've seen many nurses from Africa that have gotten themselves into bonded labor schemes in other countries, where they are working and half of their salaries are being taken by an agent who the only thing the agent did was to tell them how to do the application. Sometimes they use their own money to apply and to go. This is exploitation. People should be aware. Many of them are now critical care nurses, perioperative nurses are no longer getting access to those wards they are supposed to work. They're hopping from one care home to another to make up the hours and to make up what is enough to keep their body and soul together. This is not professional development. It's not advancement in your career. It's actually retrogression. And I think we need to put these things, lay them very bare and let people understand the situation. Nobody should be stopped to migrate, but migration should be done in the right way so that you can add value to yourself. And at the same time, countries should put in place the right policies and measures. And let's stop also shift away, taking responsibility as governments. And we should not blame high-income countries for coming to recruit our nurses. We should take responsibility to employ them, give them better working conditions, and we should negotiate with those who are recruiting them so that they can also give something back, because the taxpayers' money has been used to train these ones. I think these are the few things I would say in concluding my comments on this session. And I want to thank you for the chance. I may have to drop a bit earlier due to other commitments that are coming up because of the Nurses Day tomorrow. Thank you.
Great, thank you so much. And as we promised, we also want to hear from our audience today. So we have a couple of poll questions, and the IT team at Johns Hopkins will pull up these questions. If you could please help us by answering these questions. The first question is, have you migrated from an African country to a high-income country to work as a nurse? So please select your response. And the second question is, have you ever considered migrating from an African country to a high-income country to work as a nurse? And that's a yes or no question. The third question is, if you are considering migrating or have migrated, what was the main reason? And we've listed a number of reasons: poor remuneration, poor conditions of service, unsafe working environment, lack of professional development activities, high workload, and other. So if you could please submit your responses, we will collate all of these responses and also summarize our conversations today. And we will share those findings with everyone who attended today. And this session is also being recorded. So we'll give folks about 30 more seconds or so to submit their responses. And I'll hand over to Mrs. Evelyn Amwako, who will wrap things up for today. But before she does, I do want to say a big thank you to our panelists, Dr. Nancy Reynolds, Madam Isabella Nana Santi, Dr. James Asamani, Mrs. Perpetual Fori Ampofo. On behalf of GDNA and the Johns Hopkins Center for Global Initiatives, thank you so much. This is a busy week for everyone, but you took time out of your hectic schedules to come and share some insights on this topic. And for that, we are very grateful. So thank you. So at this point, Evelyn will take over and give us some closing remarks.
Okay, thank you, Yvonne. And so in concluding, would like to invite you to be part of GDNA. And so please visit our website at www.g-dna.org and register to be a member. You can also join any of our committees. When you register, we have the finance committee, the research, the communication, and the educational committee. So join any of them and contribute your time to support the work of GDNA. We also ask you if you are able to make a financial donation to support GDNA. all the donations that you make would go to support the work that we are doing in Ghana. And so we encourage you, if you are able to, please support us by making a donation. If you are interested in sharing your knowledge or in teaching, please volunteer to lead any of our webinars or become a preceptor, as well as facilitate our simulation sessions. Also, kindly engage with us on our social media networks. Next slide. Next slide. Yes, a bit of update on upcoming events of GDNA. Oh, okay, so what are the benefits? What do you gain by becoming a member of GDNA? You join an amazing network of Ghanaians all over the world who are doing exciting things. And so it's an opportunity for you to partner, to collaborate. Also, we have mentorship opportunities where we link you with experienced nurses who will guide you along your career path. We have preceptorship, scholarship opportunities, job opportunities as well as professional advice. Also, for Ghanaians that are working in the diaspora who would want to come back to Ghana to practice, we have a collaboration with the Nurses and Midwifery Council of Ghana to facilitate your licensing process when you want to come back to Ghana. These and many others are exciting opportunities, are one of the reasons why you should join GDNA. And so we encourage all of you to join. Next slide, please. Also, update on our upcoming event. We have a virtual information session on May 20. This will give us a chance to give you more information, detailed information about the work of GDNA and how you can be part. So join us on our information session. The link will be shared on our website and all our social media networks. And then for those of you in UK, we know we have a lot of Ghanaian nurses in UK. So we have an in-person meet and mingle session on June 3rd. That would be at Dartford. And so for all our Ghanaian nurses in the UK, please meet us in Dartford. Let's interact, let's network, and let's get to know ourselves. We have recurring webinars where you would be able to get CPD points. And then we have two fairs, two conferences that are scheduled in the last quarter of the year. On October 28th in Baltimore, and then towards the end of December and early January, we have conferences. And so please mark the dates on your calendars and join us on those days, and then let's meet and network. Yeah. We would like to stay connected with you. Please follow us to get updates on the work that the Ghanaian Diaspora Nursing Alliance is doing. And so please follow us on Instagram, on Facebook, on Twitter, on LinkedIn, and also on our website at www.g-gdna.org. In concluding, again, we'd like to express our appreciation to our panelists for very insightful and informative discussions. Also to the GDNA executive team and advisory council for the work that has been done in the background to put this together. Also, appreciation goes to the Johns Hopkins Center for Global Initiatives, the International Council of Nursing, the Johns Hopkins School of Nursing IT team for collaborating with us to organize this webinar. Also, finally, to all our participants who have joined from across the world, we thank you for your time. We hope that the information or the discussions that we have had have provided you with new insights, new ideas, and perspectives on the issues at hand. Once again, thank you for joining and being part of these very important discussions. Happy International Nurses Day. Thank you.
Hey, thank you so much, everyone. The link to the session today will be posted on our website as well as the Center for Global Initiatives website. So with that, we conclude our webinar for today. Thank you and take care.